So through COVID has probably been, for me professionally, the hardest of my career, which is probably about 17 years. The equipment loan service that we set up basically came from our learning and the development of our discharge service, which is what we offer, and seeing that we know that equipment is something that is so vital in moving children from hospital to home or to another placement if it's not home. And so what we've found in our learning is that without these specific pieces of equipment, children cannot leave the hospital.
Every hospital wanted ventilators and humidifiers, so there was a waiting list, wasn't there, for some of the equipment, which made it difficult.
But as a team, we recognise that actually if we can, we know what the children need, we know what's safe for them to move out of the hospital. If they don't have it, they stay in the hospital. So therefore we found a solution which was basically to provide temporary pieces of equipment, loan piece of equipment from some of the ones that we've mentioned, to facilitate a discharge home. From some children it was days, in some children it's months. And we're discharging children home into the community, and so it's not the responsibility of the hospital necessarily to provide that, but it's community services and CCGs who are also being impacted by those kind of the supply and demand problems. And so therefore, as a team, we recognise that actually if we can, we know what the children need, we know what's safe for them to move out of the hospital. If they don't have it, they stay in the hospital. So therefore we found a solution which was basically to provide temporary pieces of equipment, loan piece of equipment from some of the ones that we've mentioned, to facilitate a discharge home. So one of our patients that I guess was a real benefactor of the pilot was a little girl that had multiple complex needs, and she had lots of systems of her body affected by different problems and conditions. And so therefore, as a factor of that, she required lots of different pieces of equipment. And so both parents, but the mum particularly, was very much like, I want to be at home, I need to be at home. They had other children who were fit and well, who weren't in the hospital, and they'd been, obviously COVID had divided them as a family. Their daughter had been in intensive care for numerous months, and this was their their exit plan. They wanted to be out of the building, and so the equipment loan kind of came together quite quickly, because myself and Mary had a lot of experience with understanding different pieces of equipment. So it was brilliant because Mary knew exactly how to kind of liaise with the different teams in the hospital, but also start planning for that exit strategy with CCGs, with the community teams, to kind of have that transfer and that handover quite quickly. I was able to then negotiate with the teams here to kind of loan that piece of equipment, because obviously everybody was trying to hold on to their equipment because everybody needed it. And so between the two of us, we knew we worked well together as a partnership to move that forward. After the child had gone home, we had correspondence with the dad, didn't we, via email, and he was just like, I can't thank you enough, for everything you have done. We're now a family at home. And to us, that's what it's all about, is about bringing people together where they want to be. Yeah. And we kind of worked it out on an approximate of the cost around the equipment and the things that we were able to loan, and it was well in excess of £150,000 for that particular child. Obviously it affects different children in different ways, but if we were to do if we're looking at numbers, we approximately feel it's about 1,000 bed days, approximately, and approximately we feel it was in excess of £300,000 saved. It's approximate.
And that was just 6 children.
And that was just
based on 6 children.
A case study of 6.
And
So I think the team had a good track record before COVID. Now when COVID came, everything changed. The stakes were higher, staying in hospital was riskier, and people were scared, and families were worried and anxious and wanted to go home. But I think when you look at children with complex medical needs, they have so many battles that they're fighting. So actually, so one episode that's shortened by a few months has an incredible impact on not only them, but their parents, their siblings, their, you know, the extended families that they live with. So I think that the primary impact is on them and their families, and of course there is an impact if there are beds available for routine surgeries and other things that we're trying to start up again, then that would be a good thing. Oh, they're amazing. They are ambitious, brave and compassionate, and they bring all of that to the table. Ultimately, the team spirit is something that has been nurtured for many years, and it is around that feeling of connectedness within the team, and that feeling that you're working together for a greater purpose. And I think that is something that you see really clearly when you work with this team.